McDougall, Doctor of Physical Therapy, here with Corvallis and Albany Sport and Spine. I'm going to talk about a pelvic position, both posterior and anterior. So those are the directions that our pelvis can move to help allow us to find a better postural alignment and better pelvic stabilization to be able to then stack the rest of our spine up on top of that. So I'm going to start laying down. Our posterior pelvic tilt is where we tuck our tailbone underneath, pulling our pelvis bone here backwards, and then relaxing. So when I do that, my low back pushes flat into the ground, and this is making a scooping motion here. So if we imagine having a bowl of soup, it's kind of sitting sideways there, but you want to be able to pour soup out that back side of it where my thumbs are. We can also go anterior with our pelvic tilt. So now I'm going to think about my hip bones pushing forward or up towards the ceiling. That's going to make an arch in my low back, or a little tunnel here where you can put your hand through. Relaxing back to the center, we'll do a couple of those. So really trying to make this motion come from your two hip bones and not from your spine, because I could do that through my spine and ribs as well, but we're focusing on the pelvis here. So to show both of those, posterior, back to neutral, anterior. Can also find this position sitting and standing. So coming up to sitting, same thing, tucking tailbone underneath, and then relaxing, or tucking hip bones to the front, making that sway in the back to neutral, tucking under. And then we can move this to standing, tucking under into that pelvic tilt, neutral, and then forward, anterior tilt, neutral, posterior tilt. This is important, like I said before, to allow our pelvis to be in a good position, to have that foundation to start to stack the rest of our spine and our head on top of.